This is called the Compass MS Care Series. Tonight's program, we are supported by EMD Serono, Bristol Myers Squibb, and Genentech. And our exhibitors for tonight are Optum, Sanofi Genzyme, TG Therapeutics, Novartis, Bristol Myers, and EMD Serono. And again, because we're the only MS organization providing live in-person events, pharmaceutical is very much behind what we're doing and to be able to be there for all of you as well. So tonight, our speaker is Jeffrey Siegel, and he is not here, okay? Power of the internet. He's online. See, there he is right now. And he hears what I'm saying, okay? But Jeffrey is working from his home base, all right? And tonight he's going to speak to you for about 30 to 35 minutes, and then we're going to do a Q&A. So, without wanting to get too much into this, please just know that Jeffrey Siegel is an MS exercise specialist, and let's get him started. Thank you.
Hello from afar. How's everybody doing? I can't hear your response, so I'm assuming that you're doing great. I hope if you missed this or if you're watching this that you'll be able to watch it or spread the news to other people, give them information, show them how to see it when it's aired. But right now this is live and I'm coming from my gym in my house. I want to thank Stuart. I want to thank MS Views and News. And I want to thank everybody out there who has heard the diagnosis of you have multiple sclerosis, because these programs are meant for you. And I've dedicated basically my work and my life to figuring out ways to live better with MS, and not just for myself, but so other people can live better with MS as well. And it's important because when you're given a diagnosis, such as MS or anything with initials, it's scary. It's going to scare the hell out of you. I mean, and for some people, it's a relief. I mean, I know for me, it was a relief. I've been living with it since '98, so I don't know, 20 something years. But the biggest fear is, what if it's something worse? So for everybody who's out there who has MS and you're worried about being the person with MS, there's a lot worse out there. It doesn't make your MS any better, but just think about that. It's not the worst possible thing that can happen to you. And I've heard that from a lot of people. It's the worst thing that could have happened to me. Well, of course, because it did. But it's not because it didn't happen. It's because you're living with it. And that's the key. And that's the point of these programs. It's not about what is MS, because we know what MS is. It's not about who has MS. It's about how we're going to live with MS, coexist with an illness, do stuff that we used to do or want to do or that we had dreams of doing in the future. And how can we do it properly? I've been in this field with exercise and specialist in MS. I became a special in MS around 2010. In generally speaking, special population specialist is what it's called. I did go to college for this. I did study a lot, and I did a lot of practical work, which is what's most important, especially when you have a disease like MS. It's not something that you know what's going to happen next. Your doctor doesn't know what's going to happen next. You don't know what's going to happen next. You just have to live and find out. And by doing so, it can either be bumpy or you can be prepared. And that's why exercise has been a part of my life since I was little. And most people, exercise is a part of their life because there's phys ed, PE. If anyone still knows what PE stands for, it's physical education. And that's where we start from the ground. I mean, when you're a child, really playing outside in the sandbox is probably where you start. And I guarantee you, for all the people who think they can't exercise that really can, if you got to act like a 2-year-old, you're going to also laugh like a 2-year-old because it's fun. It was fun being 2. Not that I can remember, but it was fun. And I watch other children laugh and giggle with no worries. If they had a disease, they wouldn't know it. They don't even know what the words meant. They wouldn't know what it meant if they were told. All they know is, that's funny. I laughed. I like that. I don't like that. This is fun. This isn't fun. They may fart. They may throw up. They may do something else. But at the end of the day, a child is pure and they're able to do so much and their mind is open. So if you have a child that's young, feed them good information, because that information is going to stick with them for their life. Now, what I'm going to tell you about is exercise and MS and all that stuff. I'm hoping that this sticks with you. If you don't exercise, it's you that's suffering from not exercising. I've heard so much this week from so many different people, and it's weird that it happened to be this week because the people who I've been talking to are not people that that were expecting to hear me speak this week, nor are they listening to me right now who said some of the things that they said to me. But I want you guys to understand. And something else that came out, everybody who's listening, I get a message a day about Epstein-Barr and about mono. And you know what? About 10 years ago, I started getting a message a day about MS and mono. And about 20 years ago, I started getting messages about mono and MS and Epstein-Barr. And guess what? There is a correlation. There's been known to be a correlation. I haven't had Epstein-Barr, so I don't know what's going to happen for people who haven't had it if they're going to fix MS by fixing Epstein-Barr. But let the doctors do that. Let the professionals do that. Let the specialists teach you how to exercise or teach you how to rebound from an injury. And that's why they give prescriptions. Personally, I believe that every doctor has caught on. They know that exercise is the key to making sure that the meds that they're going to prescribe, or if they choose not to prescribe meds, exercise is what's going to keep people at their state that they're at right now or increase their abilities. We do not want to lose our abilities, and losing an ability is like losing a limb. It's not fun, but it doesn't mean that you can't get around it. That's what exercise can do for you. Neuroplasticity is a result of getting your blood flowing, exercise, and after your exercise and you keep doing it and doing it and doing it, the results are you can think more clearly, you can do a little bit more, you can strengthen your muscles. So muscles can be strengthened. Walking muscles can improve. It doesn't mean your walking is going to snap right back into the way it used to be, but it may. I don't want this to be about me, but I can tell you that there was a year that I could not walk. I couldn't take more than a step. The second step was the floor with me on it. But I learned how to do it again, and I walk pretty normal now. There's times that I don't, but most of the time I do. And the times that I don't, I sit down. And that's key, because rest is as important as drinking water, as is any other thing that's pertinent that you do. Water is something that it should be in everybody's hand. Where's my water? I have a water really close. If I don't, it's because I finished it. Let's see. Let me see if there's water come flying in, and I got water. So this was full about 20 minutes ago. Without water, things just don't work. Messages don't move as well through your body. Blood doesn't move through your body. Getting information from your mind to your mouth is nearly impossible. And don't try to prove me right or wrong, because that means you go further into dehydration. But dehydration stops everything. Imagine if you took water, breathing, and sleep away. This is what would happen. All right, that would be really boring. Life doesn't have to be boring. So for me, exercise, I learned exercise the right way, the wrong way, and then kind of in between, and then went back into the science of it. I was diagnosed when I was 25 years old. I was 265 pounds, and I hadn't given up on football yet. Just all the coaches and teams did. I was past my day. But after all that had happened, I decided to lose weight and read and learn as much as I possibly could about exercise and what was known about exercise in relation to MS. And it took me about 3 minutes to cover all that material, because then that's about all there was. There was a great study that came out in the 90s from, I think it was out of Utah. Then the next study was Dr. White in Gainesville. These are big studies that were groundbreaking. And then it wasn't Utah. Utah was more recent. And then in Hamburg, they came out with the studies. The outcome is exercise helps. Exercise works. Exercise helps maintain what you're doing. Exercise will help you become, still able. In order to exercise, you have to know how to do it right. There's all kinds of different exercises. And if you think about exercise as just lifting heavy weights and doing that kind of stuff, you're right. That's one part of exercise. It's called bodybuilding or strength training. it doesn't mean that's the kind that you need to do. It means that you need to find what's right for you and do it, and talk to a professional, talk to your doctor. But I can tell you that I can't promise you, because I don't know what's going on when you go to the doctor, but I don't know a single neurologist that routinely tells people with MS that they shouldn't exercise. I know that most neurologists have endorsed it for the past 15 to 20 years, exercise as something that's a must. And they also endorse a good diet, and they also endorse some of the medications, and they find what's right for you, and hopefully you find what's right for you and you stay on it. Now, with that being said, do you know what happens if you take a medicine that works for you and you don't act on it and you don't use that to your benefit? Absolutely nothing. I mean, you wouldn't know if you were getting better because you're not doing more and you're not trying to do more. So in order for these meds to work properly, you take the meds, they're going to allow you to do things that you might not have been able to do, or they might allow you to do stuff for longer than you would have been able to do in the past. We don't know what the end point's going to be, but we do know where we are right now. And if the meds are working, we got to capitalize on using our body the way it's supposed to be used. We move all the time. There's always motion going. If you don't believe that, just put your hand on your chest and tell me what you feel. And if you don't feel anything, that means that you probably have a little bit of numbness in your hand. You should be feeling your heartbeat. And your heartbeat is something that's constant. It has to beat for you to live. The better conditioning and the better shape that you're in, and I know this is easy to say and it's harder to do, but it really isn't, because doing a little bit more just means getting off your ass and doing it. I am not ashamed to call people out, because I've gotten calls all this since I can remember, where they're asking me, well, if I do this, can I do that? And if I do that, can I do this? And my doctor didn't tell me specifically what to do. Well, guess what? It's up to you. If you choose not to exercise, you know who's going to be hurt by it? You and the people that you love around you. They will not benefit from you being a better person, you being able to do more. If you ever were to fall and you don't exercise routinely, good luck getting up. Chances are, if you have not gotten on the ground and gotten back up in a long time, or haven't done squats, or haven't stood up out of a chair in repetitiously, or done any kind of exercise, it might be difficult to get up off the ground. And that's scary, because then you got to dial 911 and the phone might not be right next to you. So you might be sitting there for a while. And I want to say that I had somebody who I've been working with for over 10 years that for the first time got up off the ground. It was phenomenal. And you know why she did it? Because she believed that she could. And if you believe you could do something other than fly, unless you're in an airplane, you have a greater chance of doing it. Exercise is not always going to be safe, so you have to make sure that the surroundings you're in are safe. And there's a proper amount for everybody. I really wish that doctors would take every patient and write on their scripts, move more, or something that has to do with exercise. Because if they write on a pad to go get this medicine, you're going to run to the pharmacy and you're going to get the medicine, you're going to take it, and you're going to wonder, now what? So every doctor, I don't care if it's an MS doctor, if it's a neurologist, if it's an endocrinologist, I don't care if it's a gynecologist or an eniologist, they should be telling their patients to move more, because we're in a sedentary time in history for people, and this is getting worse and worse and worse, especially with COVID and all that kind of stuff. People are getting fat, or let me say people are getting fatter. And it's not helping people move. It's not helping society. It's not helping them out in any way, shape, or form. And it's hard to move when you don't want to, and it's hard to move when you put some weight on, and it's hard to move when you feel bad about yourself. But once you start moving and you feel the benefits of more of extra movement, you're also going to start glowing, so to say. People around you are going to pick up on it, and they're going to exercise. And exercise is something that we've done, like I said before, since we stood up. It's just doing more than you normally do. There's a few different types of exercise that you can do that I want to speak generally about: cardiovascular exercise, muscular strengthening, muscular endurance, and some flexibility. Those are keys to well-rounded exercise program. Now there's Pilates. That's very good. Pilates is a good regimen to follow. It's not the only one to follow. Same thing with yoga. Yoga is great. It's not the only thing to follow. Strength training is great. It's not the only thing to follow, but if you can combine them all, you end up with a more flexible body. You're able to move more. Have more plasticity, and it's all helpful for you. So people who are teaching this, or people who are having people teach Pilates weekly, or all that stuff, it's up to you to do it. Just like I said before, if a doctor tells you to exercise and you don't do it, you're going to get that much out of it. And if you think that your doctor doesn't want you to exercise, ask him, ask her. They do. They want their patients to do better than anyone else's patients, because that's how everybody should be. If you're treating somebody, you want them to do the best they possibly could. So when you're talking about cardiovascular exercise, I'm going to use cardiovascular as to coincide with the word aerobic, because aerobic exercise and cardiovascular are similar. Cardiovascular or cardiopulmonary exercise is actually, the definition would be to help your heart, and your heart's a muscle. So what happens is when you exercise and in a rhythmic way with large muscle groups, you push more blood around, you're training your heart. So what happens as an outcome to that is every heartbeat that you have utilizes more oxygen. And if that's the case, that means your heart doesn't have to beat as often. So the more and the better condition you are, the slower your heart rate's going to be at rest. And that's a good thing. I mean, just because your heart rate is below 60 doesn't mean you have bradycardia. I mean, by definition it is, but you want your heart rate to be as low as it can be at a safe level at rest. And when you exercise, that will also allow you to utilize more oxygen and do better at what you're doing. The next thing I'm going to talk about is muscular strength. I said muscular endurance and flexibility. So with cardiovascular training, it's best to be done 3 times a week. Now, I'm going to give you more than 7 days in a week when you add all these up, because muscular strength should be practiced 3 times a week, muscular endurance 3 times a week, and flexibility 5 to 7 times a week. So there's not that many days in a week, but if you combine everything, it'll make better sense and it'll help you out. And some people think that, a lot of people think this. A lot of people get confused with being deconditioned and having just fatigue from MS. And you can actually be both or neither and still have MS. But if you start an exercise program, I can tell you one thing. It's not going to only be people who have MS. You're going to get tired. You're going to get tired because you're doing something that you haven't been doing regularly. That's hence why I said beginning an exercise program. So beginning an exercise program, like I said, 3 times a week for cardiovascular training, 3 times a week for muscular strength, 3 times a week for muscular endurance, and flexibility is 5 to 7 times a week. So the intensities that you're going to want to work at for cardiovascular. Now I'm going to get a little bit analytical, but I'm going to make sense of it to you, hopefully. So you're going to want to work 50 to 85% of your VO2 peak. That's oxygen consumption, or 60 to 75% of your heart rate peak, or 50 to 85% of your heart rate reserve. If you're taking a beta blocker or something for your heart, forget all of that because your heartbeat and your heart rate's not going to go up high enough to calculate it. But the simplest of calculations with somebody who's not medicated on something that would change the heartbeat would be you take your age, you subtract 220 from it, and then you multiply the intensity that you want to work at, say, like I said, 50 to 85%, and there you go. That's the amount that your heart rate should be while you're exercising, and still be able to talk. If you can't talk when you're exercising, that's another test. It's the talk test. That means you're going a little bit too hard. You don't want to go too hard. I have a feeling not too many people are going to do that. As far as going too hard or overexerting themselves. So that's how you would work with the intensity. I'm going to stick with the cardiovascular training for now, or using aerobic equipment such as a treadmill, a bike, something that's safe. That's the most important thing about everything I'm going to talk about is safety, because safety comes first. Once you find out that you got a safe program and that you're in a safe position to do it, you can continue doing it. So those are pieces of equipment such as, like I was saying, a bike, ellipticals, seated, recumbent, if you have balance problems. That way you can be locked into something. You're not going to fall off the bike. And some considerations, I mean, actually 30 minutes at a time, you should be doing cardiovascular conditioning. However, you can combine that with that strength training, and you can combine that with flexibility training. Any kind of strength training should be considered flexibility training if you're doing it right, because you're going to a full range of motion. Anytime you go into a full range of motion, you're increasing your flexibility, and it can take the place of a static stretch or a passive stretch. Some considerations if you are doing this type of exercise are balance. If you have poor balance, a treadmill might not be the best thing for you, but using the handrails, it might be. And if not, then you may want to get onto an elliptical machine or a bike. And if it's a recumbent bike, you're locked in. You can even get a seatbelt on it. But those are the things those are some of the things. Balance, temperature. The perfect temperature to exercise indoors is, for people with MS, is 66 to 70 degrees, according to the American College of Sports Medicine. It may seem cold to you, but it's not once you get moving. Once you get moving, you're going to get hot. You're going to get warmed up, and you should warm up when you start exercising. Prior to beginning the actual program, you do a pre-warm-up. Some other things that you might want to consider, or at least keep in mind, are people with MS may have autonomic nervous system issues, so their heart rate and their blood pressure may not respond properly to exercise. Talk to your doctor about that. If you feel you're someone like that, they'll understand. Cardiovascular dysautonomia is not something that your doctor wouldn't know about, but it is kind of rare. I've seen it. I've worked with so many people with MS. I'd say probably less than 1% of the people I've worked with have shown it. And it's by taking blood pressure and heart rate during an exercise routine. And if it drops when you're doing stuff, then you got a problem. That means cool down, get into a safe position on your side or something. So if somebody's working with you, that's who would probably tell you that you're having these issues. Bring that information to your doctor. If anything worse than that, you call 911 and get checked out. But talk to your doctor about that, because your nervous system has many branches of it, and your autonomic nervous system is something you have no control over. And if your doctor picks up on that, there are things that they can do, and they can or at least give you precautions to take. So the other one is seated aerobic activity is great, especially if you're not someone that can stand. There's so much that you can do seated. I'll show you a couple things. I'll be back. So if you're sitting down, I'm going to show you my warm-up that I do with everybody, if they can, is chops. Now, I've showed chops. If you haven't seen me do chops, you can watch one of the videos. Go to MS Views and News site on YouTube and look up one of my videos and find chops. But these are seated chops. Standing chops are the same thing, but you pivot so you keep your hips and your shoulders square. But chops are this. So you're basically moving in a diagonal way, and then you do them this way. You can actually make this your whole workout. I mean, it'd be a little bit boring, but if you did this for 30 minutes, your heart rate would be up and down and side to side. The thing about going side to side, though, this is an important thing that most people don't realize, but you give something to somebody to do and they want to do it full throttle. They want to go all out and they want to work it. So if I told someone to do rotational movements like this, I'm pivoting my feet. You can't see my feet. You can see my hips and my shoulders are staying square, but I'm not grinding my spine. And I'm not going as far as my body will rotate. I'm using my muscles to stop myself and return back. If I were to go all the way and let my body just stop when it couldn't go anymore, that's basically a terminal range of motion, and you can get injured by doing it. So I'd rather you not do that. This happens to be a sandbag. It's only think 5 pounds, 4 pounds. And there's a lot you can do with it. I mean, if going back to the seated position, remember, I'm talking aerobic activity. Just doing something like this, especially for people that only are using their upper extremities, or something like this. Now you're working your core or getting into it. If you can sustain this and keep doing this, see, I'm not out of breath right now, but my heart rate's picked up a little bit. Or if you can't walk, but you can lift your legs, marching in place is something you can do seated. Also with this, you can slam it. Now, that's the fun part. Let me angle this down a little bit. So I'm doing extensions, hip extension, and I'm lifting my body up and using my lower back. I'm working my glutes from a chair. It's incredible. You can work your butt while you're sitting on it. That's how you get the most out of things, by doing the things that you normally wouldn't do. You know, you take whatever your daily life is and you add a little bit of intensity to it, and you got to work out. It's simple as that. I mean, if you can walk and you think you can't walk 4 houses away from you, walk 3. Next day, try to walk 4. If you can't, come back. Eventually, you might be able to do 4, and then you'll go for 5. But if you stop when you still have enough energy to do a lot more, you're selling yourself short and you're not increasing your stamina. You want to increase your stamina. You don't want to confuse fatigue with just being deconditioned. And being deconditioned is just laying around doing nothing. I do that at night when I'm sleeping, or at night when I'm not sleeping, because I don't sleep every night. And I try to get as much sleep as I can every night. And if I add it all together, it works out. So muscular strength. Muscular strength is a broad subject, but muscular strength is how hard you can, with how much force you can push something at a sustained level. In order to do that, you work it 3 times a week, and you do it at 80% of 1 RM max, which means 80% of what you can do one time at total is about 8. You know, so you want to stay between 8 and 15 reps. If you stay between 8 and 15 reps, and you go 1 to 2 reps, 1 to 2 sets per workout of whatever that exercise is, you're following what's indicated for MS and exercise. That's the guidelines. You do that, and and if you get to 15, what I like to do, you add a little bit of weight, keep it at 15, add a little bit of weight. You know, this isn't during the same workout, but this is over a period of time. This is all this coupled together. What I'm talking to you about will help with neuroplasticity, that word that nobody talked about 10 years ago, but 5 years ago, it was like they invented sliced bread. It's been going on forever. I mean, MS is one of the illnesses that exercise helps tremendously, because it does produce brain-derived neurotrophic growth factor, BDNF, and that allows you to broaden your horizons. You know, it allows you to do a little bit more and think a little bit more clearly. And I can tell you right now, even just from sitting here and moving around, I'm thinking a lot more clearly than I was about 10 minutes ago when I was yelling and screaming at everybody. I have like these people that get the production over here going, and wouldn't that be nice? But that I was doing something kind of like that. There's just not that many people here. So back to what I was saying, 80% of 1 RM. 1 to 2 sets to start out, you know, and you can add to that, and stay between 8 and 15 reps. You get under 8, it's going to be, it is strength. It's muscular strength, because 4 to 8 reps. But as far as practice goes, you know, that does kind of bridge between muscular strength and muscular endurance when you get up into the 15 rep range. And these are things that you can do. So if you can't do it, I don't want to hear about it. Do something else. I want to hear about what you could do. If someone can't walk and they're telling me that they didn't walk yesterday, okay. And what about the day before? But if they can't walk and they said, but I got on the ground and I did this and that and the other, hey, that's something incredible. That's something that you should be doing. You should feel the ground. If you can get up off the ground, get on the ground and try to get up. And if it wasn't easy, you should practice some different ways of getting up. I can talk to you about that for, I can take over the whole talk of just about different ways of getting up off the ground, but that would also lead to me insinuating that you're going to fall. And I don't want you to fall. I want you to exercise and prevent the possibility of future falls. That's what's important. And if you do fall, that's not the time to learn how to get up. So that's why I said it's good to get on the ground, try to see if you can get up. And if you can't, hire somebody to help you, a professional, somebody that understands. One of these days I'm going to go over the research because I'm done with it. I got enough subjects to do and say and discuss what happened, but I had 10 people that were working out for 10 weeks with me in a program where everybody had different abilities, but the program was still made so that everybody's outcome was similar, and that's benefiting from exercise. Don't worry, I'm going to get back to the next stuff with muscular strength, but I started out the program where 3 out of the 10 people couldn't get off the floor, and I think 5 out of the 10 people couldn't get off a chair without assistance. When it was all said and done, all 10 of them were able to get up off the ground and out of a chair without using their hands. Not off the ground, but off of a chair. I'm not saying if you can't walk and you can't stand up that you're going to be able to after this, but I am saying that after doing 10 weeks of an exercise program, you will see benefits. You will see things that you couldn't do, whether it be the amount of weight that it was or how smooth the motion was when you were doing it. But if you're walking and somebody can see you and you look rigid when you're walking, or if you go to grab something and you have some ataxia and you can't do it smoothly, and you practice and you practice and you practice and it helps, hey, you're on the right track. That's what exercise does. Exercise is a group of things that you do that you keep practicing. And if you start an exercise program, it's difficult at the beginning because you have not neurologically adapted to the actual movement. So for about 6 weeks into a program, you're going to see strength gains like you wouldn't believe. You might not see physiological changes that coincide with the strength gains, but that's because at the beginning of an exercise, if you were to lift something, let's see, even if it's something like this. Let's say I had you doing, this is a medicine ball, shoulder presses. If this is the first time you ever did a shoulder press, it's going to look like this for the first rep. Maybe, you don't really know how to do it. And then after a while, maybe whether it be within that program or over a couple of weeks, once you're able to start doing it smoothly, what happens is you're able to utilize the strength of your muscle for moving something rather than just controlling how steady the movement is. So you're able to push more weight. So your strength is going to exponentially have gains for those 6 weeks. And then you're going to start moving along the way everybody else who's been working out, and then you start to see the results. So don't give up after 6 weeks. If you look in the mirror and you're like, I don't look any different. Chances are you do look different. You just don't notice because you look at yourself in the mirror every day and you don't notice the changes. But if you start a program and you're really serious about it, take a picture and then look at the picture and then see how you're doing. Take a video of how you're walking and then take a video of how you're walking in the program at the program ends. And that's something I shouldn't have said because a program shouldn't end. It should be continued. It should be continued whether it was with physical therapy or if it was somewhere else. Make sure that it was, make sure that you continue it and don't quit like a diet. Diets only last as long as your goals do. And once you're in the diet, you're probably going to go back and end up where you once were. So diets are about the way you eat. So change it to the right way. So I'm gonna move a little bit quickly on this, but muscular strength, 30-minute duration. It can be combined with the aerobic stuff because you can add aerobic activity in between or during or do circuits, machines, dumbbells, bands, that type of stuff, medicine balls, or even body weight. If you can't stand up out of a chair 10 times, then you're in the right rep range to build muscle. Considerations that you might want to think about are unilateral movement. Sometimes one side is stronger than the other, more controlled than the other. Weaknesses, spasticity, and fatigue, and understanding when your fatigue comes and what to do and how to prevent more fatigue. And some recommendations are work to correct imbalances. If one side's stronger than the other, get it with a professional, try to get it worked out. Rest at least a day after starting. Once you get going, you can do back-to-back days once you're conditioned enough to do it. But make sure you have a spotter. Now you got muscular endurance. Here's another one. 3 times a week, 40 to 50% of 1 RM is what you're going to be working at, and 1 to 3 sets up to 15 or more reps, because it's endurance with resistance. So it's resistance and endurance. Same thing goes, machines, the same types of machines you're going to be using, the same considerations that you'd have for muscular strength and for aerobic activity. And it's also going to be a little bit longer. Now, the last thing is flexibility. Flexibility should be done 5 to 7 times a week. That could be at the end of the workouts. The best time to do flexibility is after a warm-up or after you cool down from your workout. There's many types of flexibility. Like I was saying, if I'm doing a squat and I'm going all the way down, I'm going to stretch my glutes, stretch my quads a little bit. If I'm doing a deadlift, I'm going to stretch my hamstrings. If I'm doing a tricep extension, I'm going to stretch my triceps when I'm doing that. So that's all flexibility training with some help from the weights. Some of the types of stretching is static, some is assisted. You can use a rope or a towel. Make sure you do it seated on the floor. And I have a table here so I can show you. This is what it would be if you're on a table. There's many stretches you can do. I'm going to show you a couple quick ones right now. Like without sitting down, just when you wake up in the morning, what do? That's the first stretch of the day. And you know what? It might be the last time you stretch of the day. I don't know. But you want to keep it consistent and you want to keep it going. So I'm going to sit back and see if we have any questions right now, because I've been talking for a while.
I am doing aquatic therapy. It is warm water, and everybody had said to me, I love my neurologist, or everybody always talks about how heat so bad. And bottom line is, do you think that doing an hour or an hour and a half, 3 days a week of warm water therapy is less beneficial or more beneficial? Because I'm getting benefits from it.
What she was asking, let me, I'm going to go off the phone and to the speaker here. Okay, what I heard her say was she's doing warm water therapy and exercise and aquatic exercise. And she hears all the time that doing stuff in the heat is not good. And exercising for extended periods of time isn't good. And everything you're hearing is correct. It's not good to exercise in the water. It's not good to exercise too long in the heat. And everybody who has MS is different. So therefore, it might be okay for you, but it doesn't mean that it's going to be okay for the majority. It's going to be the minority, because that's just the evidence that we have. As MS patients and as practitioners, we see people have more problems in heat than any other condition. So it's best to tell patients to be careful when doing stuff in the heat. There are a few people that have more trouble in the cold than the heat, and there are some people that have no issues with temperature sensitivity at all. And if you're one of them, live your life, enjoy it, and get the benefits out of exercise in whatever temperatures you feel is right. But warm water exercise for people who don't have MS is not completely indicated, because the temperature for normal people, not that we're not normal, but for a regular normal population, is 80 to 84 degrees in the water. So for you to be getting benefits in a temperature higher than that, it's rare, but go for it. Do it if it's working. And if your doctor doesn't agree with it, I can't say disagree with your doctor, but if you're seeing benefits, it's an individual case and it's working out. And there are some other people that might get that benefit, but people who have problems with heat know it, and they don't go into the water and do that stuff. So So it's safe to tell people not to do it or to stay away from it. It doesn't mean for everybody, but for you, if it's working, hey, I'm not going to take that away from you.
Say that again?
It was the temperature range is what I was looking at.
Okay, it was just the temperature range that she was looking for.
The what?
The temperature range.
On the water.
The
80
temperature range of the water.
to 84 degrees in the water. That's what should be. Most people that get in the water, 80 to 84 degrees, it's too cold for them.
Okay, thank you for that. All right, anybody else have a question? Let me check the online people, see if anybody had a question online, because nobody in the audience has any questions. You keep making your eyes, Jeffrey. All right, yes, we have questions online. All right, so give me a moment. I got to find my glasses that I dropped before.
Yeah, good luck.
Great, thank you, I got them. All right, first person says, if muscles are sore after the first day of workout, I'm just wondering if it would be more helpful to continue to work through the soreness by continuing the next day to do a scaled down workout using the same muscle group. And this person continues, instead of taking the day off, a penny of your thoughts, please.
I would highly recommend not to work the same muscle group 2 days in a row if you have MS. I'd highly recommend you not to work the same muscle group 2 days in a row if you don't have MS. If you work the same muscle group 2 days in a row, you're leaving other muscle groups out, but it's definitely not indicated to work the same muscle groups back-to-back days.
Thank you.
Does that answer your question?
It's going to have to because I can't see them. All right, next one. Person's writing, I love exercising, but lately it becomes challenging as I'm in pain, been trying 5 meds and nothing helps, and my legs are really exhausted, so I have a hard time getting up and doing anything. Any suggestions?
Yes. When you're talking about getting up and doing stuff, are you talking about at a high intensity, or are you talking about just movement in general? Because if going from A to B hurts, or if just staying at A hurts, not doing anything, what's the difference? You may as well get to B. So exercise is something that you want to listen to your body, and if it's hurting more than when you weren't exercise, I would be a little bit concerned, and maybe it's the form, or maybe it's something else, or maybe you're viewing exercise as what the professionals do. So take a step back, and it's okay to do less, because you'll get a lot more out of less, because it's more than nothing.
Okay, next question. What do you think about the password exercise machines such as the Kubii, Cubii, that allows you to sit and cycle?
I think that's great. I'm not sure exactly which one you're talking about, but if it's this, where you can put this on the ground and you ride while you're seated, this is basically a portable bike. You can put it under your desk and you can ride it with your feet, or if you can't move your legs, you can put it on top of a desk or a table and use both hands like this. And as far as if it's helpful, of course it's helpful. You're going to raise your heart rate. You're doing more than you would at rest. Anything more than you do at rest is good, as long as it's safe.
All right, Jeff, that was the last question, but I do want to thank you very, very much for being online with us tonight, and we look forward to seeing you hopefully in person soon, okay?
I'm ready. You let me know, and I'll see you all and
Absolutely.
get your questions ready.
I'm shaking your hand virtually, okay?
There you go.
There you go. Okay,
thanks
great.
to all you
Thank
who are
you.
watching. Thanks to the sponsors. Thanks, Stuart. And thanks to my help here.
All right. Thank you very much. And again, thank you, Jeff, for being here, and you all have a great night. Thank you.